1220 KBET.
Santa Clarita in the year 2000.
Duffy Watson, president of Henry Mayo Newhall Memorial Hospital in Santa Clarita. What is the major issue confronting those in healthcare between now and the year 2000?
To rein in cost without sacrificing quality, I think, is going to be the major issue that we're going to face in healthcare throughout the United States for the next 10 to 15 years. I believe that the first issue that we're going to have to deal with is making sure that that all of us in healthcare, physicians, nursing homes, hospitals, pharmacies, focus on cost, focus on quality, and we do it in such a fashion that we have our alignments focused together so that one segment of the healthcare process is not trying to take advantage or disadvantage either patients or other segments. So I think the big issue that we have in healthcare is making sure that all of us that are in the healthcare profession are going to work together to focus on the twin issues of maintaining quality while reining in or reducing the cost.
Duffy, what are some of the changes you see up ahead at Henry Mayo Newhall Memorial Hospital?
Well, I think with cost and the issue of growth in the valley, people in the past have focused on how many beds does a hospital have, how big is it. That's becoming much less critical. I've been in healthcare for about 25 years now, and we used to believe that we needed about 4 beds per 1,000 to take care of a population. The futurists are now saying that we ought to be thinking of 1 bed per 1,000. And those that are planning today are planning something like 2.5 beds per 1,000. So I think the issue of expansion or size is going to be much less of an issue because technology will allow us to take care of patients outside of a hospitalized setting. And we're going to find that we're going to develop programs that are more cost-effective, like adult day health care, where we can take care of patients during the day with rehabilitative services, with psychiatric services, and allow them to return to their home in the evening, giving family members a break, and at the same time upgrading the health status of the patient, making sure that they're properly fed, that they have proper exercise, that the techniques that we know work with mentally confused or patients with Alzheimer's, reorientate them to the world. And I think more outpatient services are going to be the principal way that we're going to reduce costs for the general population. For those patients that have to be hospitalized, we're going to see, I think, increased cost. There are going to be fewer patients needing more critical services. To help mitigate those costs, we're going to be using more technology enhancements, both in terms of equipment and computers. I believe at Henry Mayo Newhall Memorial Hospital by 4 or 5 years from now, all of the beds will have bedside monitors that will have nurses doing all of their charting, physicians reading the patient charts right off computers adjacent to the patient's bed, so that we'll have a better flow of information to the members of the healthcare team that will be able to work together to make sure that the more critically ill or injured patients are taken care of without a knowledge gap based upon having to record things in paper. We're working with our hardware vendor, IBM, and our software vendor, First Coast Systems in Florida, to pilot some of those bedside terminals now. And I think we'll see an expansion of knowledge that occurs quicker. And I also believe that we'll see physicians' offices integrated into the information loop, so that when physicians have patients in the hospital, they can monitor them on a continuous basis from their office. They can be more efficient. They can be seeing patients in the office. And then if they know that they've got a difficult patient, they can check that patient in the hospital between patients in the office. Physicians will be able to receive all of their reports via computer link-up. We now have about 25 physicians in this community that are linked to the hospital information system and can receive all the lab and x-ray reports. That will become the norm throughout the nation, because physicians are going to have to be more efficient with their time so that they can take care of more patients.
Duffy Watson, president of Henry Mayo Newhall Memorial Hospital. What is your service area, and in what areas of medicine does Henry Mayo Newhall Memorial Hospital specialize, and how might that change by the year 2000 here in the Santa Clarita Valley?
Our primary service area, we believe, is about 175,000, extending from Fillmore up to Piru and Frazier Park, all the way over to Acton, and down to the intersection of 5 and 14. And in that large area of about 450 square miles, we think we have about 175,000. I think our strengths probably lie in our obstetrical program, most of our outpatient services, our cancer program, which has recently been surveyed by the American College of Surgeons, and for the 6th year in a row been awarded the highest mark of excellence that the American College offers. The surveyor indicated that he felt that our cancer program was a model in a community setting, and probably one that most hospitals would not emulate for another 20 years. And by that, I think he tried to understand the outreach that we do in educating citizens in the community about the risk of cancer, the support that we receive from the community to support our cancer education programs, etc. I think our areas of strength are probably our emergency and trauma programs, our obstetrical services, our cancer programs, and our whole array of education and outpatient programs that we offer in the community.
Duffy, what addition, if any, might we see at Henry Mayo Newhall Memorial Hospital by the year 2000?
I think the one area that I expect will be an added clinical service of the hospital will most likely be neonatal intensive care. As the population continues to grow, I think we'll have volume in the community, and we have the expertise from the physicians so that we can economically sustain the care of high-risk infants in the community, and mothers then will not have to leave the community to offer that choice for themselves and their baby.
The president of Henry Mayo Newhall Memorial Hospital in Valencia, Duffy Watson, with his perspective on health care here in the Santa Clarita Valley, Santa Clarita in the year 2000.